expert in. And today we're going to talk about mental illness in Bucks County and most importantly, the resources that are available to residents of Bucks County. So how are you today, Kim?
I'm good, thanks. And I appreciate that you had that great interview with Hannah. Fortunately, she went out and had a baby afterwards. So
She
pretty
did?
so we snuck
Congratulations,
that in right
Hannah.
before she left. So yeah, so anyway, but I am looking forward to talking about the mental health resources that we have here in Bucks County and how BCHIP's kind of playing a role in that, particularly related to advocacy work. So that'll be
Great.
good.
Yeah. As we always talk about, BCHIP is right in the middle of all of the healthcare initiatives and healthcare services in Bucks County. Today, we're talking about mental health. And I just want to say, as someone who has had some crises pop up in her life, certainly in the last 10 years, there's a lot of issues and a lot of people suffering from things like anxiety and depression, trauma, addiction. It's just not you, it's your family member. So for instance, if you have a family member that is going through an addiction issue, that is going to cause stress, anxiety, and possibly depression in the rest of the family. So it becomes the ripple effect, as I like to say. And what we want you to know here is that there's so many resources available. And again, BCHIP sits in the middle of collecting those resources and then sharing them for all of you as a resource. So Kim, why don't you get started?
I appreciate that, Jennifer, and I appreciate you sharing that because, it's really interesting to me. One of the biggest challenges in a lot of the work that needs to be done around mental health is around stigma. And so I think that we're definitely making progress. Post-COVID, we've talked about mental health and mental illness, both more than I know we have in years previous. So I'm glad to see we're starting to have those conversations and really normalize mental health along with physical health being a priority. We still have a long way to go, right? And so, for instance, I do have a family member. I've met many family members actually, but that either have substance use disorder or diagnosed with mental illness. And one does not live locally. And in trying to support my family, I had said, you really need to call for crisis support and crisis services. And the response I got from my family member was, well, we really don't want our neighbors, to think differently of us. We live in this very affluent neighborhood and, we're a very good family, quote unquote. And I said, well, that's exactly correct. And so I think that anybody thinking that your neighbor is not impacted by substance use disorder or mental illness or depression or, either somewhere in their own home or within 2 degrees of separation, I think would be astonishing. I don't know anyone in my, direct circle of friends, which unfortunately is pretty large, that doesn't either in their own immediate family or an extended family have someone who is struggling with mental illness or substance use disorder. So I think just getting through that stigma and realizing that all of us are talking about this or living with this or experiencing this somewhere in our life is really an important message for everybody.
Yeah, and it has nothing to do, I think, a long time ago, it was viewed as weakness or, well, you weren't raised correctly or don't talk about me or, that's your issue. You should, pull yourself up by your bootstraps. You should be able to handle it. And what we're learning now is with anxiety and depression specifically is that they spiral. And suddenly, someone does head towards the line of overwhelm. And what happens when we get overwhelmed? We can't sort things out. And as Ken is going to go through a list of resources that BCHIP has compiled, there's multiple ways to reach out. You can reach out anonymously over text now and text with someone if that's where you're comfortable. So there's so many, and here's the other thing. I give everyone out there permission not to tell anybody that they're in therapy, in crisis, or in overwhelm. You don't have to tell anybody. It's like
That's
your own
true too.
business.
Mhm.
So
Or if you're comfortable, you can tell everybody and
like I do.
and get response, right? That's me. And get the response that you need from the people that love you and support you,
Right.
right?
And the right
Because
people will support you. And the people that make
exactly.
fun of you or whatever, they probably shouldn't be around you right now anyway.
Yeah. That's exactly right. That's exactly right.
Sorry about that,
So
but
as we start to talk about resources, the first that comes to mind for me is just the national campaign on 988.
right.
988 is the parallel to 911. And it is for mental health supports. So whether someone is in crisis or whether you need to call and just say what resources are out there for me or for my family or for someone that I know, 988 is a really valuable resource. And I was surprised, and we may have talked about this before, but I have, 5 young people, 21 to 27 in my life. And so we were talking with some of them and with my kids and my stepkids. And I said something about 988. And my daughter, who's usually very informed about public health issues, said, "What's 988?" And I said, "Oh no, like you don't know? If you don't know, we're really in trouble." So I'm just going to ask folks that are out there, if you aren't sure what 988 is, please know that it is a resource for mental health support. And to tell everyone and anyone you know that there is a resource for mental health support by calling 988. It's not a perfect resource. It's not perfectly funded yet. And there are some things that we're doing from an advocacy perspective to try to get more support and get it funded. And right now, locally, our calls aren't being answered in Bucks County. They're being answered outside of the county, and we're working to resolve that quickly. But it is a valid resource, and it is valuable, and it does share good resources with folks. So
Yeah, and you can just call, or I think you can text it too.
you can text.
Phenomenal.
Exactly. So that's one of the resources I think that is really valuable. And then another agency that, I'm not sure if everyone's aware of is NAMI, the National Association for Mental Illness. And we have local chapters, Bucks County, Montgomery County. There's a state agency for NAMI, and they provide incredible resources to folks. They have a lot of peer support programs. They have tons of support groups. They have a walk at least once a year, golf outing, and some other projects that are really about breaking the stigma. But particularly if you need support, it's a really valid resource, a really good resource for folks to be familiar with. Additionally, of course, we have all the efforts that our providers put in. We have Lenape Valley, Penn Foundation. There's a lot of organizations providing mental health services in Bucks County, but there's also some new folks. We have some new providers that have come to the table because there really is, and we never have enough resources, I don't think, but I think we're heading the right direction. An organization called Forge Health.
Right.
And they have a specialty. They'll work with all folks, but they have a specialty in serving the needs of veterans. And so they have immediate openings available for people who need appointments for support. You hear lots of times of people waiting weeks or months to get the care they need. Some of that, there are barriers associated sometimes with insurance that really can lead to that. But Forge Health has been a really valuable resource in our community. And we have another provider called Ellie, ELLIE. They're in Warrington, and I believe they have immediate openings, and they also can provide services for children. Now they do, that is, on a fee for service, and it is insurance based. So that again could be a barrier if your insurance doesn't participate with them. But for those that do, it's a valid and valuable resource.
Yeah, and I'm going to say, if they accept insurance, I applaud those providers, because there are so many mental health providers that are one shop. I mean, I don't blame them at all. I'm just saying that, you call 5 or 6, children's therapists in the center of town, and no one is accepting insurance. So it's $175 an hour. And you're up the creek, right? You're either paying out of pocket or your kid isn't going. And that's happened to our family several times when we've needed, mental health support, and we either can't find a provider that has openings, or they don't take whatever insurance it is that we're using. And again, the insurance, filing for an insurance as a standalone provider could be a full-time job. So it's hard.
And then on top of it, when they do file, the reimbursement rates are so low that they can't afford to take insurance, right? So that's something that folks, I don't think, understand so much either. You might be familiar with the fact that, say you, I don't know, go to the hospital emergency room and you get a bill for $1,000, and you'll see the adjusted rate on your bill might be $300, and the company pays the hospital $300, and you pay your copay of $100, and the hospital's out the $600. right?
Right.
For mental health, if you had a bill for $1,000, the reimbursement rate might be $100. And so instead
Exactly.
of that 300 or 400. And so when we're talking about advocacy opportunities, that is one of the things that we need to start talking about is the parity in mental health, and that we need to work with our insurance companies to say, you know, we really need to have higher reimbursement rates for mental health, so that people that are practicing in mental health can afford to make, to make ends meet and want to stay practicing and accepting insurance. So there's a lot of work that needs to be done there.
Yeah, and I've often said, and this is general, and I have no, as a statistician, I have no numbers to back this up, but I have often said that if we solve the mental health issue, right, we have access, things like homelessness, domestic violence, whether you're a victim or the perpetrator, addiction, issues of addiction, aggression, power, whatever they are, so many different facets of our society that are in crisis or that cause crisis would actually start to lower. I realize this is going to take a very long time, but I'm saying so many of those, I believe, trace back to a mental health issue. If people could get reasonable care, affordable care, oh my gosh, we could actually start to solve some problems, which would be great.
And I do know there's a commitment to do that. So when we look at community health needs assessments, and there's a lot of, mental health and substance use disorder escalate to the top in all of our community health needs assessments. We're fortunate our county is responding. They're building a crisis response center in Doylestown. We're hoping it'll be completed in 2024. It's a step in the right direction for sure, to have those services available when we haven't had them available before. I think that we'll need to continue that work. I think we need more than one crisis response center in Bucks County. So I'm hopeful that, if we are met with great success in that work, that we'll be able to model that in both upper and lower Bucks County as well. But that's a lofty goal, and I recognize that. It takes a lot of money to do this work. And I think that what we need to focus on is a lot of the prevention stuff, right?
Right.
And so our government, our state government, Governor Shapiro is committed to, increasing mental health funds. But it's interesting to me because, and I hate to be quoted, but I'm going to be because we're live, but I think he increased it by like $20 million to address the mental health needs. But really what we need is like 200 million, right? So while we're heading the right direction, it's, to really have an impact on this stuff, we need significant increases in resources related to mental health, but we don't have an endless budget, right? So we have to, where's that money going to come from? So
Right.
I do acknowledge that we need to be, reprioritizing maybe some other things, and nobody wants their funding cut. So
Right.
it's
Yeah,
challenging.
I'm also looking up Bucks County. They have a page on their website dedicated to mental health issues. So if you go to buckscounty.gov and search on mental health, it's divided out by children, teen, and adult, which I think is great. Recognizing that there's not one-stop shopping for every type of therapist.
Yep.
So there are services available.
There are. And we're getting more. We have some new resources come into the community. Organization called MindSpring focuses on peds, and they currently have telehealth appointments available. And we do find, while I prefer live appointments for these types of things, or I think that there's benefit in having live connections. Certainly, we know youth for sure probably really prefer and do a really good job with the telehealth stuff. So MindSpring is a new one. We have Kids Peace that's not in Bucks County, but serves the needs of Bucks County for kids. Foundations has been around for a long time, and they provide services for kids as well. So there are resources there. It's just that folks, sadly, either themselves are in the situation where sometimes they're not clear-minded enough to reach out and find those resources, or as family members and friends, sometimes they just don't know where to start.
Right. And that's why it's so encouraging. I caution people when I say encouraging, there is a lot of attention paid these days to mental health awareness. Certainly, if you're on TikTok or if you're on Instagram, there are people that are talking about self-care, which was something I never heard of growing up. No, again, pull yourself up by your bootstraps. You're fine. You have food,